Hello, this is Robert Whitaker with Epica Animal Health. This is the first video in our 12 case types of Epica's HDVI technology series. Today we're going to talk about dentistry applications with HDVI. In dentistry, we can identify all of the teeth, the roots, and the surrounding anatomy in both 3D and in 2D using this imaging modality. We can confidently diagnose and treat anything associated with dentistry or oral surgery for that matter, utilizing our technology. And we can also reduce the time that it takes to do a dentistry procedure, essentially reducing the time it takes to get good imaging in dentistry cases. We're going to talk about a couple of cases today that were scanned with HDVI. This one was scanned with a Pico. This is Bromley. He's an 8-year-old corgi. I got a letter from Bromley's veterinarian, and in her physical exam, he presented with swelling below his left eye, and she decided to go ahead and put him on some antibiotics for 5 days and then bring him back for a dentistry. They took digital radiographs of the mouth, and then of course they used their Pico to take a HDVI CT and get 2D and 3D images. A long story made short, the dental radiographs did not reveal anything that was really helpful to Dr. Cardenas. She took two different views of that premolar area under the left eye and found really nothing. But the HDVI scan, the CT scan, absolutely did. So you can see in these images here that in the lateral and what we call a lateral view in radiographs, we would call a sagittal view in CT. We've got an interesting little abscess developing here under that premolar. And then in 3D, it shows it even more clearly. So this was an example of an early intervention that had a very positive outcome, and without the Vimago or the Pico CT involved, it would have been a very different outcome. Our next case is a 3-year-old lab mix named Hank, and he was scanned by a Vimago. He came in with bad breath and an oral mass that you could see at physical exam. This came out of Peregrine Radiology's case bank for dentistry. So they went straight to the Vimago for an HDVI CT scan with Hank. This oral mass was essentially found to be coming from the mandible, and you can see in the images where the mandible has deteriorated as a result of this. Now, the radiologist, Dr. Bob O'Brien, indicates that this is most likely some type of a cancerous situation. If one were to go through the entire CT report, it also says that you need to get a biopsy. We've got over 300 of these units deployed since 2013 into small animal practices. But you can count on about 20 cases per month for every full-time doctor, just in dentistry. And if one were charging $125 for that scan, this machine produces $2,500 per full-time DVM each month. There's other benefits associated with this. It's not just only the money. You're saving time, which is also money in a form. When you can produce one more dentistry a day because your imaging is much faster, 15 minutes to do oral radiographs versus less than 1 minute, 24 seconds exactly is the scan time for a dentistry. That's a huge time savings. Please go to our website at epicaanimalhealth.com to learn more. You can learn about the Epicare warranty, service, and maintenance program there. You can download our CT buyer's guide, and you may also register for our CT 101 education course that's taught by one of our radiologists, our chief radiologist, Dr. Bob O'Brien. If you want to see other real cases scanned by Epica's HDVI CT units, we have them on YouTube. Just scan this QR code and you will be taken to a YouTube playlist with over 100 cases scanned by our technology.